Did you know that 1 in 7 women in the United States experience postpartum depression? This means around 700,000 women annually may face postpartum depression after giving birth. It's a severe mental health condition that affects women after childbirth, causing continuous feelings of sadness and hopelessness. Unlike the baby blues, which typically resolves within a few weeks after birth, postpartum depression can last for months and can affect a mother's capability to care for herself and her baby. Symptoms of postpartum depression include extreme fatigue, irritability, changes in appetite or sleep patterns, difficulty connecting with the baby, anxiety, and, in severe cases, thoughts of harming oneself or the baby. Postpartum depression is a mixture of hormonal changes, physical changes after childbirth, sleep deprivation, and emotional factors, such as stress and lack of support. It can affect anyone, even women with no previous history of depression. Postpartum depression is a challenging journey that many new mothers face, but it's important to know that you don't have to go through it alone. In this video, we'll dive into some practical and powerful ways to cope with postpartum depression, from handling stress to creating a supportive network. Whether you're struggling with the overwhelming emotions of new motherhood or simply seeking guidance, we'll explore actionable steps that can help you reclaim your well-being. So keep watching this video if you're ready to take charge of your mental health and embrace your postpartum journey with more confidence. Number 1. Medication. Medication is a widely recognized and effective option for managing postpartum depression, especially in cases where symptoms are severe or do not improve with other interventions. Antidepressants, such as SSRIs, are commonly prescribed that help by balancing brain chemicals influencing mood and emotional stability. These medications are considered safe for most breastfeeding mothers, as many SSRIs have minimal transfer to breast milk and pose little risk to the baby. However, please consult a healthcare provider to determine the right medication and dosage tailored to individual needs. It's important to note that these medications typically take a few weeks to show noticeable improvements, so patience and consistent communication with a doctor is key. While some mothers may feel hesitant about taking medication due to stigma or concerns, it's important to remember that treating postpartum depression not only improves the mother's mental health, but also strengthens the bond with the baby and enhances the overall well-being of the family. Number 2. Exercise. Exercise is a powerful and natural way to cope with postpartum depression, offering both physical and emotional benefits that can significantly enhance a mother's well-being. Engaging in regular physical activity helps release feel-good hormones, which improve mood, reduce stress, and combat feelings of anxiety and sadness. Even walking, yoga, or stretching can make a significant difference, especially for new mothers who may not yet be ready for intense workouts. Incorporating exercise into daily routines can also enhance sleep quality, increase energy levels, and lower feelings of fatigue, which are common challenges during the postpartum period. Group fitness classes or postnatal yoga sessions can provide additional benefits by fostering social connections with other mothers who may share similar experiences. Adding to this, exercising outdoors offers the added advantage of sunlight exposure, which helps regulate serotonin levels and supports overall mental health. It's essential to start gradually and choose activities that align with one's fitness level and preferences, keeping in mind any guidance from healthcare providers regarding postpartum recovery. Regular exercise not only improves physical health, but also strengthens a mother's confidence and resilience, empowering her to navigate the challenges of motherhood with greater ease and positivity. If you're enjoying this content so far and want to stay up to date with more health tips and benefits, hit that subscribe button and join the Health Vitals family. Number 3. Maintain a healthy diet. A healthy diet plays an important role in overcoming postpartum depression, as proper nutrition directly impacts brain function, energy levels, and emotional stability. Your diet should be rich in whole foods that provide the essential nutrients needed to support recovery and enhance mood. Omega-3 fatty acids are especially useful as they promote brain health and may reduce symptoms of depression. Complex carbohydrates from whole grains and legumes help stabilize blood sugar levels, preventing energy crashes and mood swings. Adding fruits and vegetables to your daily routine provides a sufficient intake of vitamins and minerals, such as folate and vitamin D, both linked to improved mental health. Probiotic-rich foods like yogurt and fermented vegetables can enhance gut health, which has been shown to influence mood through the gut-brain connection. Hydration is equally vital. Drinking enough water throughout the day helps combat fatigue and enhances overall bodily functions. Try to avoid excessive sugar, caffeine, and processed foods, which can worsen feelings of irritability or lethargy. For breastfeeding mothers, a nutritious diet also supports milk production and provides energy for caregiving demands. Meal prepping or seeking support from family and friends to prepare healthy meals can help ensure consistency in eating well, despite a busy schedule. Number 4. Build a support network. It's one of the most effective ways to cope with postpartum depression, providing emotional strength, practical assistance, and a sense of connection during a vulnerable time. Surrounding yourself with understanding and supportive individuals, such as family, friends, or community members, can ease the feelings of isolation and overwhelm. Sharing your thoughts and emotions with trusted loved ones helps lighten the emotional burden, offering reassurance that you're not alone in your struggles. Joining new mother groups or postpartum support groups can be especially valuable, as these communities consist of people who share similar experiences and can offer empathy, advice, and encouragement. Professional support, such as counselors or therapists, is another critical component of a robust support network, providing expert guidance and coping strategies tailored to your needs. Even small gestures, like a friend helping with errands or a family member taking care of the baby for a few hours, can create space for you to rest, heal, or engage in self-care. Online forums and virtual support networks also offer a great way to connect with others and access resources when in-person interactions may not be possible. Number 5. Practice self-care. It's a fundamental way to cope with postpartum depression, as it empowers mothers to prioritize their well-being while managing the demands of caring for a newborn. Self-care involves intentional actions to nurture your physical, emotional, and mental health, which are often overlooked during the postpartum period. This can include simple yet impactful habits like taking short breaks to rest, enjoying a warm bath, or reading a favorite book to recharge your energy and lift your spirits. Making time for activities that bring joy, whether it's listening to music, meditating, or pursuing a creative hobby, helps combat feelings of stress and fosters a sense of normalcy. Physical self-care, such as maintaining good hygiene, staying hydrated, and incorporating light exercises like yoga or walking, enhances overall well-being and contributes to emotional stability. Setting boundaries and learning to say no to unnecessary commitments can reduce overwhelm, while asking for help from loved ones or professionals ensures you're not navigating this journey alone. Adequate sleep, though challenging with a newborn, is also a crucial part of self-care, as sleep deprivation can exacerbate symptoms of depression. Even small acts of kindness toward yourself can build resilience and create a positive ripple effect in your overall mental health. Number 6. Prioritize sleep and rest. Giving importance to sleep and rest is crucial for overcoming postpartum depression, as lack of sleep can significantly worsen mood, heighten stress levels, and impair overall mental health. While the demands of caring for a newborn often disrupt sleep, finding creative ways to rest can help restore energy and emotional balance. Adopting a flexible schedule, such as sleeping when the baby sleeps, can maximize rest opportunities, even if it means taking short naps throughout the day. Sharing nighttime caregiving responsibilities with a partner, family member, or trusted friend can also ease the burden and ensure you get uninterrupted sleep when possible. Establishing a calming bedtime routine, like dimming lights or practicing deep breathing, can help signal your body that it's time to wind down, even during brief rest periods. Try to avoid caffeine or heavy meals before bed, can further improve sleep quality. If falling asleep becomes difficult due to anxious thoughts, consider journaling or meditating to calm your mind. While it may feel challenging to prioritize rest amid a busy postpartum schedule, doing so is vital for emotional recovery, as sleep directly influences brain function, hormone regulation, and resilience against stress. Number 7. Incorporate physical activity. Incorporating physical activity is a highly effective way to overcome postpartum depression. Small, manageable activities like walking with your baby in a stroller, practicing postnatal yoga, or engaging in light stretching can significantly enhance your mental state without overwhelming your postpartum recovery. Regular physical activity also helps control sleep patterns, boost energy levels, and lower the feelings of fatigue that often accompany postpartum depression. For new mothers, joining group fitness classes designed for postpartum recovery or participating in outdoor activities like a park walk can also provide opportunities to connect with others, reducing feelings of isolation. It's important to start gradually, listening to your body and incorporating exercises that suit your fitness level and recovery stage, especially if you've had a C-section or a complicated delivery. Making physical activity a part of your daily routine fosters a sense of accomplishment, strengthens your body, and helps you reclaim control over your well-being, creating a positive ripple effect that benefits both you and your baby. Number 8. Practice relaxation techniques. Practicing mindfulness and relaxation techniques is a transformative way to cope with postpartum depression, helping new mothers regain emotional balance and manage stress effectively. Mindfulness involves being fully present in the moment, discovering thoughts and feelings without judgment, and cultivating a sense of inner calm. Several methods like deep breathing exercises, meditation, and progressive muscle relaxation are great ways to lower anxiety, enhance mood, and foster mental clarity. For instance, a simple practice like inhaling deeply for a count of 4, holding the breath for 4 seconds, and exhaling slowly can instantly calm a racing mind and soothe frazzled nerves. Guided meditations or mindfulness apps offer accessible options for integrating these practices into a busy postpartum routine, even if it's just for a few minutes a day. Activities like mindful walking, where you focus on the sensations of your steps and surroundings, or practicing gratitude journaling, can further deepen your connection to the present moment and nurture a positive mindset. Incorporating these techniques helps interrupt negative thought patterns and strengthens resilience against overwhelming emotions. Mindfulness also encourages self-compassion, allowing you to let go of guilt or unrealistic expectations and focus on your well-being. Number 9, join support groups for new mothers. Joining these groups can be a lifeline for those navigating the challenges of postpartum depression, offering a safe space to connect, share, and heal. These groups are not just about venting emotions. They provide a nurturing environment where new mothers can relate to others experiencing similar struggles, alleviating the loneliness that often accompanies postpartum depression. Through open discussions, members can exchange practical tips on managing sleep deprivation, breastfeeding, and balancing new responsibilities, while also gaining emotional validation from women who truly understand. Many support groups have trained professionals, ensuring that participants receive evidence-based advice and coping strategies tailored to their needs. Whether in person or virtual, these gatherings foster a sense of belonging, helping mothers rebuild their confidence and emotional resilience. Furthermore, the friendships formed in such groups can extend beyond the sessions, creating a support network that lasts well into the parenting journey. For mothers hesitant to attend, it's worth remembering that simply taking the step to join can mark the beginning of a transformative journey toward mental and emotional well-being. Number 10, communicate openly with loved ones. Communicating with your loved ones helps build a strong support system and alleviates feelings of isolation and overwhelm. Sharing your thoughts, feelings, and struggles with your partner, family, or close friends creates an environment where you feel understood and valued, fostering emotional relief and connection. Being transparent about your needs allows loved ones to offer practical help, such as taking care of the baby while you rest, preparing meals, or simply listening without judgment. Open communication also bridges the gap between your inner struggles and external support, helping those around you recognize the signs of postpartum depression and encouraging them to respond with empathy and patience. This process strengthens relationships, reduces misunderstandings, and empowers you to voice your concerns, whether they're about parenting challenges, your physical health, or your emotional well-being. For many, this honest dialogue can also lead to seeking professional help together, with loved ones accompanying you to appointments or therapy sessions for added reassurance. Number 11, avoid isolation. It's a crucial strategy for overcoming postpartum depression. Isolation often worsens the symptoms of postpartum depression, making it harder to cope with the demands of motherhood. By reaching out to friends, family, or other new mothers, you create opportunities for meaningful conversations, shared experiences, and emotional validation. Regular social interactions, whether it's a quick coffee date, a walk in the park, or joining a local mom and baby group, can break the monotony and lift your spirits. It's also important to seek support from your partner or trusted loved ones by openly expressing your need for company and help. Engaging in community activities or even virtual meetups can further bridge the gap, especially if leaving home feels overwhelming. Remember, staying connected doesn't require grand gestures. Sometimes, a simple phone call or text message can remind you that you are not alone in this journey. Number 12, consider therapy. Therapy is one of the most effective ways to overcome postpartum depression. It offers a safe and supportive space to guide the emotional and mental challenges that often come with new motherhood. If you opt for therapy, you can work with a trained professional to understand the root causes of your feelings, whether they stem from hormonal changes, overwhelming responsibilities, or unresolved personal issues. Cognitive behavioral therapy is particularly helpful, as its main focus is to identify negative thought patterns and replace them with healthier, more constructive perspectives. Therapy also equips you with practical coping strategies, such as stress management techniques, mindfulness exercises, and tools for improving communication with loved ones. For mothers struggling with guilt or feelings of inadequacy, therapy provides much-needed reassurance and empowers them to embrace their new role with confidence and self-compassion. Many therapists also specialize in maternal mental health, ensuring you receive targeted support tailored to your unique experience. Whether you opt for individual therapy, group sessions, or even online counseling, the consistent guidance and validation offered through treatment can make a profound difference in your recovery journey. Seeking help is not a sign of weakness. It's a courageous step toward reclaiming your emotional well-being and ensuring the healthiest possible start for both you and your baby. Number 13, set realistic expectations for motherhood. It's a powerful way to cope with postpartum depression, as it helps reduce unnecessary pressure and allows you to embrace your journey with compassion and flexibility. Many new mothers enter this phase with idealized notions of perfect parenting, fueled by societal expectations or comparisons with others, which can lead to feelings of inadequacy when reality doesn't align with those standards. By recognizing that it's okay not to have all the answers and that every mother's experience is unique, you can ease the burden of trying to do it all. Accept that it's normal to feel overwhelmed and that mistakes are part of the learning process. Prioritize what truly matters, such as bonding with your baby and ensuring your well-being, rather than striving for perfection in areas like household chores, appearance, or following rigid routines. Leaning on your support system, delegating tasks, and celebrating small victories can further help you maintain a realistic perspective. Remember, motherhood is a journey, not a race, and there's no one-size-fits-all approach. Number 14, engage in creative outlets. Engaging in creative outlets is a fantastic way to cope with postpartum depression, offering a means to express emotions, reduce stress, and reconnect with your sense of self. Creative activities such as painting, writing, knitting, photography, or even cooking provide a much-needed escape from the demands of motherhood, allowing you to channel your energy into something fulfilling and personal. These outlets encourage mindfulness by drawing your focus to the present moment, helping to quiet anxious thoughts and uplift your mood. They also serve as a form of self-care, giving you time to explore your interests and passions outside the role of being a mother. For many, the act of creating something, whether it's a piece of art, a journal entry, or a handmade item, brings a sense of accomplishment and pride that boosts confidence. Sharing your creations with others, like joining a crafting group or posting your work online, can also foster connections and provide a supportive community. Even if you don't consider yourself artistic, the act of experimenting with something new and engaging your hands and mind can be incredibly therapeutic. Number 15, manage stress levels. High stress can intensify feelings of overwhelm and hinder your ability to enjoy motherhood. Determining the causes of stress in your daily life, such as lack of sleep, household responsibilities, or unrealistic expectations, is the first step toward reducing their impact. Simple yet effective strategies like practicing deep breathing, meditation, or yoga can assist in calming your mind and regulating your emotions. Prioritizing self-care, even in small doses, is essential, whether it's taking a warm bath, reading your favorite book, or enjoying a quiet cup of tea. Delegating tasks and seeking help from your partner, family, or friends can alleviate the pressure of trying to manage everything on your own. Establishing a routine can also create a sense of stability, making it comfortable to guide the unpredictability of caring for a newborn. Additionally, getting outside for a walk or engaging in light physical activity not only reduces stress but also boosts endorphins, which can improve your mood. It's important to be kind to yourself and remember that perfection shouldn't be your goal. Progress is something you should be aiming at. As we wrap up today's video, remember that postpartum depression is a journey, and it's okay to take it one step at a time. By using strategies like therapy, support networks, self-care, and realistic expectations, you can begin to feel better, heal, and embrace the beauty of motherhood with more strength and confidence. If you or someone you know is struggling, don't hesitate to reach out for help. If you found this video helpful, please hit that like button, share it with others who may benefit, and don't forget to subscribe to Health Vitals for more tips and support on living a healthier, happier life. Take care of yourself, and we'll see you in the next video.